All right, team, welcome back to Plastic Surgery Untold. I'm Dr. Johnny Franco, also known as Austin Plastic Surgeon. We got our celebrity crew here and a special guest, Dr. Morales, who we'll get to in just a second, who's joined us on this early morning. But we've had a little hiatus. Celebrity's been at his Tuscan villa. Gilbert's been, working on his Netflix series, breaking hearts left and right. So, we'll catch up with them and then see what's been going on. Gilberto, what's new with you?
Oh, just we've had a little bit of time in between our last recording, so I've been, traveling the globe and breaking hearts, like you said.
Yeah, I mean, you made a big exotic trip to Port A, played in the brown sand, boom, boom, boom. I mean, it's living the lifestyle of the rich and famous.
I mean, you got to start somewhere.
You got to start somewhere. Celebrity, what's going on? I'm glad that you have a shirt on today. Thanks for dressing up for the occasion.
I tried to walk in without one. Dr. Franco stopped me at the door and said, "No, man, you gotta put that on. This is a PG-13 show." So,
well, this is why we brought Dr. Morales in, because you thought you were fit.
Dude,
we brought Fit Doc in.
I know
to really kind of like set the tone. Like, hey, Travis,
put me in my place.
Yeah, just a little puppy in this realm.
I appreciate that. It keeps me grounded. Man, it has been a while. Hey to everybody, all three listeners that are out there. That was a joke. We have hundreds, maybe thousands,
maybe 4 or 5,
maybe 5 at this point. But yeah, me and Mary have been traveling a little bit. The business is getting bigger and starting to roll a little bit. So things have been good. Just busy trying to keep up with everything.
Because you guys are kind of everywhere with your anesthesia business team. I love it. We're talking about something, and you're like, "Let me get an anesthesia." What'd you call it? A celebrity provider.
Yeah, a celebrity provider to their office. Yeah, we're now in Michigan, in Illinois, and then here in Central Texas. So things are, with new markets and new areas comes new kind of processes and new issues that kind of arise. So it's been fun. It's been a challenge, but it's been good.
And maybe at some point we'll have to have Dr. Morales and a couple of his team members back, because they actually, Dr. Morales and I, number one, went to med school together, if you can imagine that, way back in the day in the Galveston cruise. So that was super fun. We'll try and leave most of those stories behind us.
No.
But he is actually part of ACP, one of the biggest plastic surgery groups in Texas, and the biggest group in Houston, Texas. So, Dr. Morales, tell us a little bit about you and your specialty, and that'll roll right into why we have you on today.
Yeah, so like Johnny said, him and I went to med school together a while back, had some good times. I joined my group right out the gate from residency after I finished my residency in plastic surgery down in Galveston as well. And it was the Aesthetic Center of Plastic Surgery. It was the largest group at the time in Houston. I had heard about them for years, and I kind of researched them and, who they were, what kind of men they were, and surgeons, and reputation in the community. And I wanted to be all those things. And I was fortunate enough to join them. And we've grown the practice since I've been there. So I've been there for almost like 9 years now, going on 10. And we've definitely grown into the largest aesthetic practice in Texas. We're very proud of being leaders in community, leaders in society, and we have our own fellowship. I started a fellowship in aesthetic surgery about 5 years ago. So that's kind of my personal baby. And, we just teach them everything we know in aesthetic surgery, which is we do everything from breast and body. And that's what I do specifically, is mostly breast and body. I do everything else except for noses. And I love doing facial surgery. I'm just younger, and I haven't gotten those patients quite as much as I would like, but I'm slowly getting there.
I love the fact that, and you actually gave a talk about the fellowships in Texas, and because you've not only been a big proponent at your own practice of developing this fellowship, but also encouraging people throughout the state of Texas and elsewhere to have these fellowships. Because I love the fact that, one, kind of the old dogma of plastic surgery was like, I would learn these secret techniques, and like, I'm not going to share it with anybody because, this is like my unique special something. And you've really changed that. And for a young person, to be willing to teach and share all of your golden nuggets, I think is super special. And then to push the rest of the plastic surgeons, I thought that was really great. And it's amazing to only be out in practice 9 years and already have started a fellowship and have so many fellows underneath you. That's really cool.
It's impressive. Yeah.
Yeah, very proud of it.
But catch me up a little bit, and I've wanted to have you on the show since I actually saw a talk you gave maybe 2 years ago, because you also do a lot of butt implants, and as you know, and we can get into this a little bit, butt Butt implants is a unique procedure that not everybody does, and very few people do well and do consistently. You can tell me if you disagree, but I think there's a very, very, very small percentage of plastic surgeons that do more than 20 or 30 butt implants in a year. And I feel like besides you, there's not very many other people in Houston or in the state of Texas that do. It's a select group.
Yeah, I would agree with that. I mean, I think there's only one other person here in Houston that does them. We're the fourth largest city in the United States, which kind of blows my mind. I get it, I've given talks on the way I do it, at Texas Society,
Mhm.
at ASAP's meeting in the past couple years, and I feel like I really enjoy doing them. I really like the outcomes of them. I feel like I can give safe results, and it's just one of those surgeries you've got to find surgeons that do them often. And I would agree with you. Any surgeon that does more than 20 or 30 a year, I would say does has a good experience with doing the procedure. But it's a very, very select group of patients, and they look for surgeons that do specifically a lot of them. So I'm sure you have the same situation, but I get patients from all over the
Mhm.
country that come from West Coast, East Coast. I'm from South America, from Mexico. It blows my mind like how far these patients are willing to travel to have the surgery and go through the process of it. So
And most of these patients have followed you for a long time, but because I want to get more into some of your techniques, some of the cool things you do, because I do think there are a lot of little pearls and nuggets that people who do a lot of these do. One in terms of guiding the patients, two in terms of the actual technique that make the process, smooth for patients. But let's back up just a little bit to help guide people a little bit of why people choose butt implants or why they do that. Because the most common is Brazilian butt lift, liposuction, fat transfer, fillers, butt implants. Do you mind maybe just giving us a quick 2 minute spectrum of how you guide patients, whether they're a BBL patient, butt implant, combination, or if you believe in fillers, M sculpt, any of these things? I know that's 1,000 questions and a topic on each one of those. Maybe we'll have to have you back, but
yeah. Well, I think you probably say the same thing to your patients. I find there's two patient populations that are interested in butt augmentation, and the first one is patients who've had multiple BBLs,
Mhm.
and they're called failed BBLs because they're not getting the results that they want. They want these crazy big proportions of the butt that is just not meeting their desires, and they've kind of run out of fat. They've liposuction their face, their neck, their arm. They've just done, and they still want bigger butts. And so that's patient population one. Patient population two is typically the patients I tend to get, which are women who just don't have enough fat for the fat transfer of a normal BBL to get the desired outcome. And they're gonna be leaner, they're thinner. They just don't have thousands of cc's of fat per side that they want and give the projection and shape that they want. Um, that is going to give them the result that they want. So those are the patients I find that are more common for me, being the fact that I'm more in the kind of fitness industry and I'm known for that. And, they want these a little bit fuller, more athletic butts or, that kind of shape. But, with implants, you really have much, much more control of the shape
Mhm.
and projection, which I don't think you'll never, ever get with just fat transfer alone. Um, but also with the implants that I use, I also do the fat transfer on top of it, just kind of help further camouflage the implant on the sides, improve some of the aesthetic outcomes and shape, and just fine tuning of the final outcome. But those are the patients that are typically coming for butt augmentation specifically. Is usually those two patient populations.
Can we hit up because you hit up a couple, I feel like really important points. And one word that stands out right off the bat is projection. And I think, and you said it 3 or 4 times because I say the exact same thing. There's a real limit to the projection you can get with a fat transfer. And so no matter, and I'd love to get your thoughts. I always tell people your butt's an envelope, right? And so with the fat transfer, there's a limit to how much you can just stuff in there. And at some point, you cross some threshold where the fat either just starts coming back out or you're just stuffing it in there. And now you're at risk for fat necrosis, infections, other stuff that just becomes a little counterproductive in my opinion, and a limit to how much you're going to stretch that butt out. If somebody's got a washboard flat butt, there's just a limit with fat of how much you're going to get that out. So if you got, celebrity anesthesia's abs on your butt, there's just a limit to where you're going to get in terms of that. Would you agree?
1,000%. I mean, the most challenging patients for me, and I'm sure you could attest to this, is African American females that literally have no butt. And in that ethnicity, having like no butt is almost like a deformity. And they are just so obsessed with having something, right? They just want something, and they've done a BBL, and the BBL didn't do anything. It's just like you said, stuffing an envelope to the max. You still have an envelope flat edge. It will never, ever, ever give you projection from fat transfer alone. You have to have something stronger with a little bit of shape and force to give that projection that you want, and that's where implants come in. With the implant, you can get whatever projection you want. That will never be achieved with fat transfer alone. It's just the way it is.
But the one thing that I talk to my patients about is something that I call butt greed, and I feel like you alluded a little bit to it
Yeah.
there because
Mhm.
whether you do multiple rounds of fat transfer, whether you're doing implants and fat transfer, I feel like sometimes people have this vision in their head, and sometimes you and I have to have the like come into reality talk about like, hey, here's your body shape, here's what you can actually handle, here's what you're actually gonna want. Is that something that you deal with? Because I feel like with butt implants and I'd love to hear how you kind of walk people down this or decide what's a good size is. I feel like there's a little bit of a limit to the size people can do safely, especially on like a primary buttock with implants. The fat around it, I feel like helps, but some people think that they can put whatever size, you put a little fat and you're never going to see the implant. And that has not been true in my experience.
I would agree with that 100%. I have some patients that feel like they've researched the procedure a lot, and they're like, I want a 455cc implant.
But
Like,
they're 4'11", 90 pounds. That's why they're coming to get butt implants to begin with.
it's like them choosing breast implants. It doesn't work like that. It depends
Yeah.
on your anatomy, it depends on your frame, your structure, and the space you have. Like, you got to trust me on this one. Like, I think I know what I'm doing. And I've in my practice, I tell them is like, I will give you the biggest butt that your body can physically
Mhm.
take. And I've never had anybody disappointed. No one's ever said my butt's too big, ever. But it's really, you got to go to that. You almost take it to the limit of what their tissue can take, right?
Mhm.
We as surgeons know what the limit of the tissue can take, how much stretch and laxity of the skin and soft tissue will relax to. And at some point, if they want even bigger, again, you can upsize later. I've done that, several times. But typically, it's really about, for me, when I have a very, very heart-to-heart discussion with my patients right out the gate about what is your expectations of the surgery, and then what are realistic that I can provide you during one-time session. So, always ask for wish pictures
Mhm. I love
right out
wish
the gate.
pictures.
It goes in their document chart. I want to know exactly what you think you're going to look like, and it shocks me every day when I see some of these wish pictures. I mean, we're talking about Instagram models. These are Instagram models that have been photoshopped on top of that, and they got these crazy proportions of waist to hip ratios of projection. I'm like, and this is what these women want to look like, but it's because social media is driving this. It's
Oh, yeah.
driving this look, and you got to have those talks with them. Like, this is not possible with this surgery, and you got to set them straight right out the gate, or else you're gonna have a lot of disappointment, a lot of frustration.
I always tell people I would rather them be disappointed when we're talking about your wish pictures than,
Yeah.
$15,000 later after you've done this surgery. I should have done it during the Olympics. I wanted to post a picture of one of the Olympics swimmers, in a Speedo, take a picture of me in a Speedo and be like, I just want a little lipo and this is my wish picture. Just to put in perspective of sometimes
I
what
wish
we
you
go
had.
through.
I wish you'd done that.
Yeah, but I was worried about us getting our account banned after that. They're like, nobody should be seeing this.
No, we've talked about this a lot, and it's come up with all facets of plastic surgery and even other specialties that we've talked to on this podcast. It's like that talk up front and setting those realistic expectations, I think, is what makes for the happiest patients long term.
Can we talk about because incorporating those wish pictures, and how do you guide people, and what implants do you use? There's round, there's shape, location of them a little bit, because you mentioned it a little bit. You have a very select population because you are big in the fitness world. You and your wife do a ton of incredible stuff, and I think you actually started either a foundation or some type of body contouring thing that we'd love to hear about in a little bit too, because I know you're doing some other cool
Sure.
stuff. But a very fit population who doesn't have a lot of body fat, who's super thin, and I feel like those are hard because they do want the big butt, but those are also people that don't have a ton of fat to cover the implants, and that's why they're there to see you to begin with. And aside from the wish pictures, do you do some things in terms of placement of the implant, shaped, round, those type of things?
Yeah, I think you and I use the same implants, the ART. that implant, you have a choice, as we call it, the anatomic. So it's teardrop shape. And so the maximum point of projection is right at the center of the of kind of the shape. And when they're athletes, or they want an athletic build, or I call it the fit butt.
Mm-hmm.
That's the implant of choice for me.
Fit
That's the
Fit
one
Butt by Fit Doc.
Yeah, that's right.
I love it.
So that's the implant of my choice. Whenever they go through, they actually want to go through it, and obviously the implant is oriented in the direction of the gluteus maximus, so you get a little bit of athletic appearance. In my opinion, a little bit more of aesthetic appearance of just a enhanced butt, where they look like they do tons of squats and hip thrusts and stuff like that, without actually doing the work. So that's the implant choice for me when they want that kind of a look, and it depends on their wish picture, what they want to look like. And those women typically show me women who are very athletic and very fit, and they're wearing, spandex and athletic, that kind of stuff. So it really depends on what they want.
I always worry a little bit about, and you talked about earlier, the projection they mount, because you can sometimes got to be careful what you wish for, because you might get it. And what I've seen sometimes is patients who want these really overly projecting butt implants because they want their really full exaggerated look. But I tell them butt implants is a little bit different than a natural large butt. It's not the same luscious appearance, and the problem is they can look absolutely fabulous standing up, but the problem is your pelvis is the main joint of your body, and when they bend over in yoga pants, leggings, like you're talking about, sometimes you can actually see the outline of that implant if they get too aggressive in terms of the size of the implant. I always explain it to them like, if you kick your socks off in the middle of the night and you pull the sheets tight, all of a sudden you can see where your socks are in the bed. And I'd love to hear how you kind of talk to people about that, because that's something I struggle with, of trying to get them a look that they love, but not something that they're going to regret, a year or two down the road.
Yeah, I agree. I kind of tailor when they're really, really lean is I find that implants don't have a crazy amount of projection, tend to work better because you have a little bit less of a slope at the edges. And if you look at the 435 round style, I think it's style 9, it has a very high projection and a small base. And so the edges are very kind of straight down, and that implant's like super visible, especially in the leaner patients. And it's amazing. That's what they want. Like they want a projection, but there's a compromise.
Yes.
Like you'll get that projection, but then when you're in certain positions, you'll see an edge of the implant. So the implants have a little bit less of slope and less projection. I find that you have a little bit less visibility on the edges there.
I agree with you. It's rare that I use one of those type of implants, because it's just as the swell and everything goes down, I worry about that. I tell them, I was like, I want something that you're going to be able to wear your Lululemons, your bikini. I don't want you to be afraid to wear those type of things, because we want you to be super happy with this long term.
Yeah. Agreed.
What about recovery in terms of this? Because some of it goes to your point of the biggest that your body can handle. Because the issue in that area is getting it to close without tension, and I think that's absolutely key. And sometimes I'll tell people, look, I'll put the sizer in, but if it's tight, we're not doing that implant. We'll sometimes have a couple choices.
Yeah. I mean, it's all about closure and just the tissue laxity. We have some women that are just a little bit looser, and you can take a big space to accommodate with an implant, but some are just super, super petite and just super tight, and you won't be able to close that hole. I mean, you just got to have that judgment of the surgeon on what you can get away with. And, for me personally, I really try to go as big as I can give them, because I've never had anybody say my butt's too big. Ever.
No, they don't. Tell me a little bit, because there's most people put butt implants either in a subfascial, so under the fascial covering, but above the muscle in that kind of distinct plane. There's intramuscular, where we split the muscle. In most of us that don't work out as much as you do, that muscle's not quite as thick as we would hope or like. But you actually do a hybrid kind of combination. Is that fair to say or true?
Yeah. Mm-hmm. Yeah, I call my technique the dual plane.
Yeah, do you want, because you're the only person I know who does this, which I saw talking, it was super cool, and your complication rates were extraordinarily low. So any kind of ideas you want to give us, talk a little bit about that, because just so for those of you listening, I actually went to one of Dr. Morales' talk, and it was absolutely fabulous, and his rate of complications, reoperations, implant loss, I mean, are phenomenally lower than the rest of America. So thanks for sharing your nuggets with us.
Well, yeah, just kind of, I developed my technique after actually talking to you, Johnny. I remember I called you and I was like, "Hey, man, I want to do butt implants." And like I've found these new implants that the ART had come out with, and I thought they're softer than implant tech. Implant techs are really hard, and I didn't like those. And kind of asked him his technique, and I was thinking about it, and kind of I studied a lot of breast surgery, and I like the dual
Hmm.
plane technique. Makes a lot of sense to me. And then I started thinking, well, if I apply the same kind of concept, partially on the muscle, partially in the breast, how could I apply that to the butt? And that's what I did basically is that I just flipped it upside down. So the way I do it is that the at the basically the top half of the butt is the implants in a subfascial plane, which is the muscle, the fascia just overlying the muscle. And then on the lower half of the butt, the implant actually goes into the muscle, so it's intramuscular. So you have this dual plane. And in my the way I perceive it, the pros of it is that you get less of visibility on the lower part of the butt, where you're going to get that some women complain you can see the edge of
Hmm.
the implant, they can feel it. You get protected because you have more muscle tissue there. You have more tissue there, and so when they bend over, you see a nice flat curve on the bottom. The second part of it is that you don't get like some of the animation issues that you have with a completely intramuscular implant,
Hmm.
and that when you flex your butt, the whole implant kind of shifts up a little bit more. It's not quite as visible with the dual plane technique. And then another pro to it is that you can put a bigger implant in, because in the subfascial plane you have all this extra space and laxity that you don't have inside of a muscle. Because when you put the implant directly in the muscle, there is no plane. There is no plane whatsoever. You're splitting the muscle. The muscle fibers are longitudinal, and you split the muscle and you throw it in there, and there's really no defined space. You can't make a round space. You can't make an anatomic space. It's just you're splitting the muscle, throwing an implant in, and it is hoping that it kind of stays where you put it. My technique, the space is very, very, very defined. I designed the space specifically just what the implant dimensions are. To me, it's a hand and glove technique. So if it's a round implant, it's going to be a round space just big enough to accommodate that implant. And if it's an anatomic implant, that's technically harder to do for me.
Hmm.
In that the space actually, the space is a little oriented towards along the line of the gluteus maximus muscle. That way the implant doesn't tilt. I don't want it to tilt up and down or shift or anything. Way. I just want it to be like that exactly. And so that space is technically a little more harder to find. But again, I have the space very, very, very well defined within the subfascial space going into the intramuscular plane. And so I feel like my pocket control is more stable. It it tends to stay where I put it. It doesn't slide off to the side. The cons of it are I really don't feel like there's any cons other than some people will argue, and I've had some surgeons argue with me that the visibility of the implant on the top half of the butt is more noticeable. In theory, that is, but typically it's not. As long as you choose the right implant, where you don't have a high projection implant,
Hmm.
that slope at the top won't be so obvious. You have a more gentle sloping implant. It goes along very nicely with the natural curve of the upper butt.
I couldn't agree with you
So
more.
I don't.
One, I think your technique is super innovative and definitely gives some huge pros. I think in terms of visibility, I couldn't agree with you more. I think it truly is the number one factor is the size, the projection of the implant. I mean, because even if you did a complete intramuscular, once you stretch that and you hurt those nerves, the same thing that we talked about in residency about deep flaps and this, once you denervate that and you stretch some of that muscle, it becomes a lot thinner than most people think in terms of how
Yep.
much buffer you're really getting.
Hmm. Hmm.
Because I've put some
Yeah.
people in a complete intramuscular, and if the implant's just too big, you can still see the edges. So I think it's a myth that you can't see the edges of the implant if you did a complete intramuscular, if the implant is just too much projection for that individual.
Yeah. I mean, I think obviously we're taught more muscle, more soft tissue cover implants are always better, and I can't agree with that more. But in this case of the body, I think it's just I agree with you. You're going to thin out that muscle, and I don't think you get quite the 100% benefit of it. But for me, it's just really about the pocket control, decreased complications, and I've done well over 200 patients now, and I've had zero infections. I know you don't believe me, Johnny, but I have zero infections. But I've had one seroma that happened at 13 months, just came out of nowhere. I
Yeah.
didn't even, I was like, what is going on? I had a seroma. I drained it, did it twice. I'm like, screw it, let's get the implants out, took it out, cured. And she's literally knocking on my door every week, waiting to get them back in. So I'm just trying to get her to cool off. And
Yeah.
I really, I mean, I took cultures. I have no idea why she got it. I mean, you got me. Another complication I had symastia, the implant fold. You
Mm.
know, I do it just like you, Johnny. I do two perimedian incisions, and she was, you know, it was kind of my fault really. She was like 65-year-old lady, and she had a flat butt. I mean, we're flat as a board, and she wanted a butt, and I gave her the butt implants that she wanted. They weren't big at all, and then all of a sudden she got really hypersexual, and then she started having had a lot of boyfriends. And within 3 months, she said that my boyfriend's complaining that my implants are touching only when I'm in the doggy style position, which makes me. She goes, Dr. Morales, I love it. Like I look great in jeans and everything's great. She goes, I ride more horses. I'm like, no, you're riding your horses. She goes, well, that doesn't hurt. I'm like, you're riding horses. What are you doing riding horses? And sure enough, she was riding horses. She told me it really had 2 months from surgery, and she just totally blew out that repair, blew them out. And so her implants are touching. You know, you could touch them together, but she said the only time that my boyfriend's complained is when they're grabbing her butt from behind and pushing them together. And so I just basically, you know, re-support the fold. I did some Galaflex and stabilize it. So that was my mouth position there. But I feel like I get consistently safe results, and my patients are happy with their outcomes. And haven't anybody say my butts are, you know, too small. I mean, I'm too big ever. So just that in itself for me, I'm very happy with.
Maybe we got to get you on Gilberto's matchmaking show here, because it sounds like you're making love happen here. I like it. Just because we're running a little short on time, what about let's touch on anesthesia and recovery. What do you do in terms of anesthesia? It's all general anesthesia. I know some other parts of the country do other stuff. Is that still how you're doing it?
Yes, full general anesthesia. The surgery itself takes me about less than 2 hours, and then we wake them up in a supine position, and then we once we're in the PACU, we put them back in a prone position when they're comfortable enough for that, and they go home like that.
Celebrity, any anesthesia tips, pearls? I know we've done a lot of these together.
No, I mean, we've talked about this in the past. We do these very similarly to how we do BBLs in your practice. But, you know, we do full generals with a breathing tube, and then patients in that prone position during the procedure. You ask for relaxation. So we'll actually relax the patient or paralyze the patient temporarily, so that gluteus muscle actually, you know, really does relax to allow you to maximize your position of the implant.
How long do you keep them off the butt? Because that's a question, and people argue about that amount of time all over. What do you typically do for your patients?
Mine's 2 weeks.
And then you let
Yeah,
them
so
start.
I'd love to. I was asking to ask you that last time I saw you a couple weekends ago at Texas Society. Is have you seen any? I guess I've seen a one, but I haven't. I didn't like it. It was a mattress that has a hole in the center cut out, so they can lay on their back but not hurt their butt. It's called. I think it's called like a BBL bed or something like that. But you know, patients on their prone position, they hate it. I don't
Mhm.
know how your patients experience, but they absolutely are miserable for 2 weeks. But for me, it's super important that implant does not move. They can't lay on their sides. It can't sit. Like it needs to stay exactly how that space I designed and has to stay like that. So for me, it's 2 weeks.
I agree. I think the first 2 weeks are the most important by far, by far. I've increased it to 6 weeks, mostly for the fat take. I truly feel that they keep more of the fat when they can stay off of it for 6 weeks. And I've tried the air mattress too. Unfortunately, it's a little bit like, you know, the one size fits all shirts and other things. You know, they
Yeah.
never fit anybody perfectly. So some people are too small and they fall all the way through. Some people are
Right.
too big and it's pushing on the edges. So I think they work for some people if you're in that small percentage that actually fits. I love the BBL pillow. I actually love, we do this wedge lumbar combo, especially if we're doing
Yeah.
something on the front. I think that has been super helpful. And going back to our old days in med school and residency of doing pressure sores, I have patients do the same kind of check underneath their butt. So their significant other, whoever's taking care of them, I'm like, if you can't slide your hand under their butt with the wedge and lumbar, you're not positioned right. And so that way the family becomes part of that process of helping them stay off the butt. And I think it
Sure.
gives the family something to do to help them and you know, make sure they recover well.
Hmm.
Um,
Yeah, I agree. I kind of encourage kind of same concepts. So, and I do tummy tucks and BBLs all the time, and I just tell them you got to keep, you know, less pressure makes things a little bit better. I think.
We need to talk about that again, sometime in this near future, because I think that has become such a hot trend and something that just makes so much more sense. The 3D, 360 shaping. The old days of just tummy tuck, lipo, and not addressing the butt, the hips, the entire shape. I think you and I have a lot of similar views on this in terms of making this whole body transformation makes so much more sense than the old days, and would love to have you back on and talk about that, because that has been such a change, and I think we've seen a lot more of it.
Yeah, I mean, you got to treat patients three dimensionally, right?
Totally.
So just doing the tummy tuck. I don't remember the last one I just did a tummy tuck straight up and down. Like it's always you're doing a little bit some to the waistline, maybe taking some of that waistline fat and put in the hips. I mean, it's always something you can make aesthetically better three dimensionally.
100%, because it's this whole, like, it used to be like, let's just pull people flat, but then you had this weird artificial, just like flat tummy. There was no shaping of the tummy. In the old days, it was just, even the liposuction was just kind of done like, I'll just take out as much fat and that's kind of it. And you and I both, like, spend a lot of time lipo sculpting them to make because even some of our patients that don't want fat transfer, when we lipo them, they're like, damn, my butt looks better. And they think that they got fat transfer even if they didn't, because we take all that into account.
Yeah, totally agree with that. I mean, you can make their butt look better just by doing what you do to the waist and their lower back.
Rolando, any last butt implant take home messages that you'd like to leave people before we get to quote of the day and behind the Bovie stuff, which we're going to ask you for a nugget in just a second?
All right. My what I encourage patients that are interested in butt augmentation, please find a American Board of Plastic Surgeon, board certified plastic surgeon. Please do this and find those surgeons that do these frequently, often, and have consistent results. And just do your research.
Agree. We do a segment called Behind the Bovie. What's one little nugget about butt implants that you think patients don't know, but they should?
Mm, when they're inside you, they're going to be a little bit firmer than you think. It's going to feel more like a hard muscle, like a hard butt when you're flexing. They always think that they're going to have they're going to be able to twerk and it's going to be soft and everything like that. And that's not the reality. It's a firmer implant. The implant has to be a little bit firmer just because to deal with the forces of sitting on it and running and jumping. And it's not breast implants. We don't have those implants in the United States. So those gel implants that they do in South America. So it's a little bit firmer, but the more soft tissue coverage you have over an implant, if you have a little more fullness of fat or whatnot, or you're a little bit heavier, that implant is just going to give you augment that kind of shape and fullness. So it will be a little bit softer. There's Instagram celebrities that can twerk like crazy and they all have implants. So you can twerk, even with, having just hardly anything, you can still twerk. It's part of your body. It's in your butt. So, that's my one thing is that it's going to feel a little bit firmer than you think. When they feel the implant, I'm sure you have them in your office too.
Hmm.
You feel it's really soft. It's a soft implant. But when you actually inside you, it tends to be a little bit firmer in my opinion.
I'm so glad you say that, because I say that all the time and I feel like I'm a broken record. So, and it's funny because my spiel is almost exactly like yours in terms of the little bit of firmness. It has to be able to take the abuse of sitting on it, those type of things. So, made my day hearing you say that. So really appreciate it. Can we jump into quote of the day?
Yep, I got one for us. Steve Maraboli said, "Life doesn't get easier or more forgiving. We get stronger and more resilient."
Ooh, damn.
I was trying to find one on strength because we got the fit doc today. So.
Oh, nice.
I
Nice. I like it.
I feel like if the pandemic's taught us anything, it's definitely made us be more resilient, and I think we've all like had to adjust and do some things in our lives. Rolando, tell me a little bit about. I saw you in Hawaii doing some other things. What's going on? Just on a little side note here about some of your big projects.
One of my passions is health and fitness, and as you guys know, bodybuilding is one of my hobbies. My wife and I turned professional together in 2019. So we're professional bodybuilders. I'm in class, and it's called Classic Physique Division, and my wife's in a figure division. So we've been doing it for now like 7 years together, and we're very much part of the community, specifically in bodybuilding. I really like the people and I like the industry. And I'm trying to, further support and be an ambassador to the brand of health and fitness, but also the sport of bodybuilding. And so I've, sponsored shows here in Texas, and now I'm getting more involved at a national, more international level now. I'm now a partner with a legendary bodybuilder down in Hawaii. We're promoting our show down in Hawaii in November. But I'm also at the level now of the kind of like the Super Bowl of bodybuilding. So it's called the Olympia, and it's going to be in October this year. And I just got invited to the Arnold Classic, which is another
Nice.
kind of
Congratulations.
another version of Super Bowl bodybuilding. And so I'm a sponsor there now. So I'm trying to, I'm slowly kind of getting more in at the elite level of sponsorship and branding the sport, because I really love the sport. I think it's inspiring people to, get off their butts and go exercise. That's all I ask, is that if people see me as a fit doc, and I live it, I live this lifestyle, I believe in it. I love helping my patients, make transformations from either losing weight to have surgery, or then after surgery, they further, get better. But, I think you can live longer and look better, with health and fitness. And so I'm very much ambassador of that concept itself. But for me personally, my brand of the fit doc, and, specifically in the sport of bodybuilding, and also hopefully in other sports, and I guess, things like that are going to help, inspire people to get up and move.
Well, and it's I love it because it's so, walking the walk of the talk, because people think, oh, is it plastic surgery, exercise, and don't realize how much it goes together. I always tell people, the better shape you come into surgery, the better you're gonna come out, and you're
Yep.
living proof of it.
1000%. I mean, it's all about keeping your body healthy. And the healthy state, plastic. I've had so many patients I've done surgery with. They ask me to do nutrition supplements, supplementation before surgery, and I've done a little bit of that, help them get ready for surgery, and then they lose some weight, and they feel like they can maintain that body weight in their lifestyle, both personal and work life. And then we have surgery, and they have, they look amazing afterwards. And then the next thing I know, they're on a bodybuilding stage, because they're
That's
so,
awesome.
proud and more confident. And that's the key word. They're
Yeah.
confident in their new body, and they love it. And they're inspiring their kids. They're inspiring their friends. They're inspiring their family members. I mean, it just keeps going. And then you keep hearing these stories of, wow, she did it. Like, look at her. Wow. And that's hopefully where I'm trying to bring, is trying to, inspire other people to live healthier, eat well, exercise, and inspire others around you to do the same.
I, I love that.
I,
I mean, health and fitness are huge for my wife and I too. And I'm a firm believer in patients do better when they are healthy. And I know that sounds so obvious, but like when you take care of your body and you're health conscious and you're working out and you're doing some form of strength training and some form of cardio, like those patients do better under anesthesia. They do better when they get sick and they end up with something emergent in the hospital. They do better with planned surgery. It's just the patients do better across the board. So yeah, I think that's awesome. I love that you're a huge advocate of that.
and confidence is sexy more than any breast or butt that Roland or I could ever do. So I think we all agree on that.
100%. You know it.
Roland, one last thing. Do you mind letting everybody know your website and your Instagram? Because I know you post some really cool informational talks pretty regularly on your Instagram as well, and your website.
Yeah. So my website's drmorales.com. And then my Instagram profile is drmorales_fitdoc. And so my profile, social profile, is more of me about my passions. And that is my passion of plastic surgery, my family. If you see me, you'll see that I love my wife, and I'm very proud of her. And she inspires me daily as a person, husband, father, all the above. So very proud of her. And you'll see, how I, you know, admire her and love her, because we've been together for 24 years. And so I wouldn't be the man without her, and where I'm at now without her. And then also, passion of plastic surgery, and for me, educating patients correctly and give them correct information. So I do these talks like once or twice a week on social media about, frequently asked questions, just something simple, usually less than a couple minutes. And I hope my patients find it, helpful, because you're hearing it from me directly.
That's awesome.
No, I love them. I've watched a bunch of them, and so I think they're great. Well, I can't thank you again enough for being on, and hopefully you'll come back and we'll talk about a little, tummy tuck, lipo, fat transfer, little 3D sculpting.
Absolutely, man. I'd love to come back. Thanks for having me.
Awesome. We'll see you.
All right.